Hello everyone. Today we will have a basic discussion on mask selection for patients with obstructive sleep apnea. Many clinicians, be it a sleep tech or a new sleep doctor, might ask which mask is best for a patient on CPAP for obstructive sleep apnea. Is it nasal mask or a oronasal mask? Which is the best one? We have several type of mask, a nasal mask or a nasal pillow, or we have the oronasal mask which covers the nose and mouth. It can sometimes it may be a hybrid version like uh, F30, or even we can have a total face mask, which we see all these type of masks being used for the treatment of obstructive sleep apnea patients at home. So when we are doing a titration studies, sometimes we see um, frequent respiratory problems and we continuously increase the pressures, and even sometimes we may change to bi-level, but it's continue the same problem. But all of a sudden tech goes inside and change a mask, and all of a sudden everything becomes better. No respiratory events, no desaturations, even uh, solid REM sleep is seen sometimes, which we as a sleep tech we always see. Not always, sometimes we see this type of pattern. And so the question is, what type of the mask is good? So the best answer would be the mask which is tolerated by the patient. That is the best mask to be used. Yes, I agree with that, but is that simple as that? As we work, due to our preferences, we develop some preferences based on our experiences, observations, and results we gained as we continue practicing the medicines. But the question is there any evidence for our practices? In this era of evidence-based medicines, we have to see any evidences are there to select any type of, or to have a preference of a mask over the other one. So let's do a quick PubMed search. I used sleep apnea, CPAP, nasal mask, oronasal mask, and adherence as a search query, and we can see that here we have 20 results. So different observational studies are there, randomized control studies are there, systematic reviews or meta-analysis are there, or even just narrative reviews are there. We can see. Let's go with the highest form of evidence is the meta-analysis, and then let's choose some randomized control trial as well. We can see that there are 6 results here. So I just used only PubMed search, and now let's see, these are the 6 studies. We can see, we can open one of the study. So here compare the efficacy, mask leak, patient adherence, and patient preference of the 3 different interfaces to treat moderate severe obstructive sleep apnea. Let's click this one and see. This is a randomized control trial. Of course, this is a good evidence. What is it saying? That the CPAP adherence did not differ between the 3 different mask interfaces, but residual AHI was lower with the nasal mask than oronasal mask, and patient reported greater mask comfort, better sleep, and overall preference for nasal mask. A nasal mask with or without chin strap should be the first choice for the patients with the OSA referred for CPAP treatment. That's what they say. So if you're looking at another, see, this is the Andrade et al. Did a meta-analysis, so which is highest form of evidence, right? So what they came up with, the conclusion is that oronasal masks are associated with a higher oronasal mask, the full face mask, are associated with a higher CPAP pressure level, higher residual AHI, and poor adherence than nasal mask. So they also suggest nasal route is the best options. There are different other studies which compare the difference between the the traditional nasal or the mask, the nasal pillow mask, and they found there is no big differences and some preferences for the nasal pillows. In short, we don't have the time to go into details of all these studies. In short, as per the study, we can see that nasal mask is preferred over the oronasal mask. What could be the reason for that? So let's look at the clinical practice guideline from American Association of Sleep Medicine for the treatment of adult obstructive sleep apnea, which is a Patil et al., published in Journal of Clinical Sleep Medicine in 2019. They say how to go with the treatment plan, etc. And additional consideration, what they say is use of nasal interfaces over oral or oronasal interfaces, and then use of heated humidification with the PAP therapy to avoid side effects. So it is been well documented that the nasal mask is the best choice of treatment for obstructive sleep apnea. If you are treating a patient in the intensive care unit or in acute care floors for respiratory failure or congestive heart failure, pulmonary edema, whatever, the treatment options, the interface selection may differ. What we are discussing is mainly on the obstructive sleep apnea patients. What could be the cause for the preference, or why the oronasal mask is making more problems? When we look at the airway, you can see that this is the nasal route and this is the oral cavity with the tongue, and we have the different muscles for the tongues, like hyoglossus, palatoglossus, genioglossus, something like that. So when we close the mouth, when we open the mouth, what happens is that the hyoid bone goes a little bit down and a little bit posteriorly, as you can see it here in this picture. So what happens is that this is the hyoid bone, this is the genioglossus, and then when the mouth is open, what happens is that bone goes a little down and posteriorly, pushing the tongue backward. Once the tongue goes backward, what happens is that the airway gets narrowed. Another possibility is that when we use the oronasal mask is that we push the jaw backward and pushing the airway again narrowed. The third possibility is that when we breathe through the nose, when we breathe through the mouth, when the mouth is open, the pressure push the tongue backward and makes the airway even compromised. So whole idea is for the compromised airway to be opened so that the air can go inside. So the best route of airway for the treatment of obstructive sleep apnea is the nasal mask. So but for the patient to convey this message, we need educating the patient, because the compliance from the patient will be like, my partner tells me I breathe through the mouth when I sleep, I open my mouth. So it is possible that now we have to educate the patient why we are opening the mouth when we sleep. If you have sleep apnea, because the airway is obstructed and you are trying to get the air. So how to convince the patient is that ask the patient to close one nostril and breathe through the other, then repeat the opposite side, as you can see that. And most of the time both the nostrils may be open, or in some patients there may be a nasal resistance and obstruction, something like that. So it's still most of the time there will be one nostril is open. So we can convince the patient saying that that is enough. If you can breathe through the nose when you are awake, you will be able to breathe through the nose when you are sleeping also, provided if sufficient air is there. So the CPAP will provide a sufficient air through the nose, and the mouth will automatically close. Not for all the patients. It is understandable there are patients who is having habitual mouth breathing. People like that may have some difficulty, but generally speaking, most of the time, once the sufficient air through the nose is available, the mouth get closed automatically. Those patients who have still there is a mouth leak, we can address it by humidification. If we have a proper humidification, or if there is an insufficient pressure, there will be mouth leak. So address that accordingly. Or in the worst case, we may use a chin strap so that the mouth leak can be controlled. In either way, the best route is nasal route. So let's look what happened for this patient. See, this area is was with the oronasal mask, and then when the technician went indeed and changed the mask to nasal route, all the problems well settled, and patient have no event and had a REM sleep in the supine position. So the take home message is that if you encounter to select between the mask, always start with nasal mask, and oronasal mask can be used, there is no harm. But if the leak is getting worse, or if the residual AHI is high, or events are not under control, as you can see in this patient, or sometimes you will see severe obstruction during REM sleep. What happens during REM sleep? All the muscles are paralyzed, or there is no tone, and the pressure or the pull of the lower strap from push the jaw backward and make it even worse. It is not seen in all the patients. 40 to 60% of the patients do have these problems, and hence the take-home message is that you can use any type of the mask, but nasal mask is preferred. Whenever you are using an oronasal mask, if the problems are not under control, or if the residual AHI is high, or the leak is high, or the compliance is low, try going to nasal mask and educate the patient and address the issues accordingly. Thank you.